Welcome to Wellness Pulse Studio. Today, we will explore the common signs of influenza and COVID, beginning with the symptoms related to coughing and the throat. Overview: Cough and throat symptoms. Sometimes just a soft cough is enough to make us pause, not because it hurts badly, but because in that moment we realize our body is trying to speak. Coughing, sore throat, throat irritation, hoarseness. These symptoms feel so familiar that they are often ignored. We tell ourselves, it's probably the weather. Maybe I drank something cold. It will go away on its own. But the truth is, many respiratory illnesses, from the common flu to COVID, begin quietly in the throat. This video is an invitation to slow down and listen to those signals, to understand what each symptom means, and to learn how to care for yourself at the right time, in the right way. No panic, no judgment, just understanding, so we can treat our bodies with more kindness. Why are the cough and throat the gateway of illness? The upper respiratory tract, including the nose, throat, and larynx, is the first place to come into contact with viruses, bacteria. Cold air, fine dust and pollution, cigarette smoke, sudden weather changes. When viruses enter the body, our immune system responds naturally, coughing to expel irritants, throat inflammation to activate immune defenses, increased mucus production to protect the lining. That is why coughing is not always a bad thing. Coughing is a protective reflex. What truly matters is this: what kind of cough is it? How long does it last? What sensations come with it? Dry cough, a soft but persistent signal. A dry cough is characterized by no mucus, a dry, sharp sound, sudden, uncontrollable episodes, often causing throat irritation. Many people describe it as, my throat feels itchy. If I don't cough, it feels uncomfortable. When does a dry cough usually appear? Early stages of flu or COVID. Dry or cold air. Prolonged air-conditioned environments. Talking a lot or speaking loudly. Not drinking enough water. In COVID, a dry cough is one of the most common early signs. Some people experience no fever, no runny nose, yet a dry cough that lasts for many days. Sensations often accompanying a dry cough: burning or scratchy throat, dryness in the throat, deep internal itching, increased coughing while speaking. A dry cough may not feel severe, but it can be deeply exhausting. Because repeated coughing drains energy, it disrupts sleep, it further irritates the throat lining. Cough with phlegm, when the body is cleaning house. Unlike a dry cough, a cough with phlegm indicates that the respiratory system is producing mucus to fight infection. Phlegm may appear clear white, yellow, green. A productive cough often occurs when the flu enters days 2 to 3, there is throat or bronchial inflammation. The body is beginning to recover. Many people fear mucus, but in reality, mucus is a protective layer, not an enemy. The concern arises when mucus becomes too thick, there is too much of it. It is difficult to expel. In such cases, people may feel chest heaviness, wheezing, extreme fatigue from coughing, sensations during a cough with phlegm. The body tenses with each cough. Deep coughing from the chest, a sticky feeling in the throat, relief after clearing the mucus. In COVID, a cough with phlegm is often not extremely thick, but persistent, accompanied by significant fatigue. The difference between dry cough and productive cough. A dry cough feels like a gentle but persistent reminder. A cough with phlegm feels like a louder process of internal cleaning. Both are natural protective responses. The real question is not, am I coughing or not? But rather, what is my cough trying to tell me? A gentle message at the end of part 1. If you are coughing right now, please don't blame yourself for drinking cold water, for staying up late, or for not taking care sooner. See each cough as a quiet whisper from your body. I need rest. In the next part, we will explore in greater depth prolonged coughing spells, Coughing that worsens at night. These are symptoms that disturb sleep and cause concern for many people. Prolonged coughing fits and nighttime cough. Sometimes coughing does not come once and then disappear. Sometimes it comes in waves. You cough, you pause, you think it's over, and then it comes back again. Longer, deeper, more exhausting. This is what many people describe as prolonged coughing fits, and for many, these coughing episodes become worse at night when the world is quiet and the body is trying to rest. In this part of the video, we will gently explore what these symptoms mean, why they happen, and how to understand them without fear. Prolonged coughing fits. When coughing comes in long, exhausting episodes, a coughing fit is not just one cough. It is a series of coughs, often uncontrollable, that can last for several seconds, sometimes even minutes. During a coughing fit, people often feel breathless, tired, tight in the chest, irritated in the throat, slight panic or discomfort. Many describe it like this: once I start coughing, I can't stop. I cough until my chest feels sore. I need to catch my breath after. This experience can be frightening, especially when it happens repeatedly, but understanding what is happening inside the body can help reduce anxiety. Why do coughing fits happen? Coughing fits usually happen when the cough reflex becomes oversensitive. The throat and airways are lined with tiny nerve endings. When these nerves are irritated, they trigger coughing as a protective reflex. Common reasons these nerves become irritated include viral infections, flu, COVID, common cold, inflammation of the throat or airways, postnasal drip, mucus dripping from the nose to the throat, dry air, acid reflux, repeated coughing itself. Once the nerves are irritated, even a small trigger, a deep breath, a laugh, a change in position, can start another coughing fit. This is why coughing sometimes feels like a loop. Coughing fits in viral illness. During viral infections, such as influenza or COVID, prolonged coughing fits are very common. In many cases, fever may already be gone. Runny nose may be mild, but coughing continues. This happens because the virus inflames the airway lining. The nerves remain sensitive even after the virus load decreases. The body is still repairing damaged tissue. This type of cough can feel frustrating. People often ask, why am I still coughing if I'm already better? The answer is simple and gentle. Healing takes time. The cough does not always mean the infection is worsening. Often, it means the body is still recovering. How prolonged coughing fits affect the body. Repeated coughing fits can affect both the body and the mind. Physically, they may cause chest muscle soreness, throat pain, headaches, fatigue, shortness of breath after coughing. Emotionally, they may lead to anxiety, fear of coughing in public, sleep disturbance, constant worry about symptoms. Many people say, I'm more tired from coughing than from the illness itself. This is why understanding nighttime cough is especially important. Cough that worsens at night. Why symptoms feel stronger when the lights go out. Nighttime coughing is one of the most common complaints. You may notice coughing increases when you lie down. Coughing wakes you from sleep. Throat feels more irritated at night. Coughing fits last longer in the dark. This can be extremely exhausting, but there are clear reasons why coughing often worsens at night. Body position. When you lie down, mucus can pool in the throat. Postnasal drip becomes more noticeable. Acid reflux is more likely. All of these can irritate the throat and trigger coughing. Gravity, which helps during the day, works differently at night. This is why many people say, I'm fine during the day, but once I lie down, the coughing starts. Dry night air. At night, especially with air conditioning or heaters, air becomes drier, throat and nasal passages lose moisture. Irritation increases. A dry throat is much more sensitive. Even gentle breathing can trigger coughing. Less distraction. During the day, you talk, you move. You focus on tasks. At night, everything becomes quiet. You become more aware of your body. Small sensations feel bigger. A mild throat tickle that you ignore during the day can feel intense at night. This does not mean symptoms are worse, only that they are more noticeable. Nighttime cough in COVID and flu. In both COVID and influenza, nighttime cough is common. People often report dry cough that worsens after midnight, repeated coughing fits when trying to sleep, waking up coughing, sore throat in the morning. This happens because viral inflammation does not stop when you sleep. The immune system continues working quietly through the night. Sometimes, coughing at night is simply a sign that the body is actively healing. The impact of nighttime cough on sleep. Sleep is essential for recovery, but nighttime coughing can cause difficulty falling asleep. Frequent waking, shallow sleep. Daytime exhaustion. When sleep is disrupted, people may feel more irritable, weaker, slower to recover. This creates a cycle. Poor sleep, weaker recovery, more coughing, poorer sleep. Breaking this cycle gently is important. A calm perspective on nighttime cough. It is easy to feel worried at night. The darkness makes symptoms feel heavier. Silence makes coughing sound louder. But it helps to remember, nighttime cough is very common. It does not automatically mean severe illness. It often improves gradually. Instead of fighting the cough with fear, try to meet it with understanding. Your body is not betraying you. It is communicating. A soft reminder. If you are listening to this and thinking, that sounds exactly like me, please know you are not alone. Many people experience prolonged coughing fits and nighttime cough during recovery. Your body is working quietly, patiently. In the next part of this video, we will talk about sore throat, hoarseness, itchy throat symptoms that may seem small, but often cause the most discomfort. Sore throat, hoarseness, and itchy throat. A sore throat often begins quietly, not with pain, but with a subtle discomfort. A dryness, a scratchy feeling, a sense that something is not quite right. Many people ignore it at first. They think, it's nothing. It will pass. I just talked too much. But the throat is sensitive, and when it starts to react, it is often one of the earliest signals that the body is under stress. In this part of the video, we will slow down and listen closely to what the throat is telling us. Sore throat. When swallowing no longer feels easy. A sore throat can feel different for each person. Some describe it as burning raw, tight, dry, sharp when swallowing. Others say, it feels like my throat is scraped. Swallowing hurts. My throat feels swollen inside. A sore throat is not a disease by itself. It is a response to irritation, a response to inflammation, a response to infection. Why does a sore throat happen? The throat is lined with delicate tissue. When viruses enter the body, this tissue is often one of the first places affected. Common causes include viral infections, flu, COVID, common cold, post-nasal drip dry air, excessive coughing, acid reflux, talking or shouting too much. In viral illnesses, the immune system sends blood and immune cells to the throat area. This causes redness, swelling, pain. The discomfort you feel is actually a sign that your body is defending itself. Sore throat in COVID and flu. In many viral infections, sore throat appears early, sometimes even before fever or cough. In COVID, some people experience mild sore throat that lingers, tightness rather than sharp pain, discomfort without visible swelling. In influenza, sore throat may feel more sudden, more intense, accompanied by body aches. Both experiences are valid, and both are common. How a sore throat feels throughout the day. Morning, throat feels dry, swallowing feels harder. Voice may sound rough. Daytime, pain may ease slightly. Talking can increase irritation. Evening, discomfort may return, throat feels tired. Swallowing becomes noticeable again. This fluctuation is normal. The throat is constantly in use. Every word, every breath, every swallow passes through it. Hoarseness. When the voice no longer sounds like you, hoarseness is often described as a rough voice, a weak voice, a breathy sound, loss of vocal strength. You may notice your voice cracks. You cannot speak loudly. Speaking feels tiring. Your voice sounds lower or strained. Hoarseness can be surprising. You may wake up one morning and feel fine, but your voice is suddenly different. What causes hoarseness? Your voice is produced by the vocal cords, two small bands of tissue in the throat. When these vocal cords become inflamed or irritated, they cannot vibrate normally. This leads to hoarseness. Common causes include viral infections, excessive coughing, talking too much while sick, throat inflammation. Dry air. During illnesses like COVID or flu, the vocal cords are often affected indirectly. Even if you are not speaking much, persistent coughing alone can irritate them. Hoarseness during illness. Many people say, "I sound sick even when I don't feel that bad." This is because hoarseness often outlasts other symptoms. You may notice fever is gone, body aches are gone, but the voice is still weak. This does not usually mean something serious. The vocal cords are slow healers. They need time and rest. The importance of voice rest. When the voice is hoarse, whispering is not helpful. Whispering actually strains the vocal cords more. Instead, speak softly, speak less, allow silence. Silence is not weakness. It is recovery. Itchy throat. The small sensation that causes constant coughing. An itchy throat is often underestimated. It may not hurt. It may not feel serious, but it can be incredibly annoying. People often describe it as a tickle deep in the throat, a need to clear the throat constantly, an urge to cough without relief. This itchiness can trigger repeated coughing, throat clearing, hoarseness over time. Why does the throat feel itchy? An itchy throat is usually caused by dryness, mild inflammation, postnasal drip allergens, viral irritation during viral infections. Even after the virus is mostly gone, the throat lining may remain sensitive. This sensitivity makes the nerves react to very small stimuli. Breathing cold air, talking, swallowing saliva, all can trigger the itch. Itchy throat in COVID and recovery. Many people recovering from COVID report persistent throat tickle, dry cough triggered by itchiness, sensation lasting weeks. This is often part of post-viral sensitivity. It does not mean you are still contagious. It does not always mean active infection. It means the tissue is still healing. The mind-throat connection. The throat is closely connected to the nervous system. Stress and anxiety can increase throat sensations. When you are anxious, you may swallow more, clear your throat more, focus on sensations. This can create a cycle. Itch, cough, irritation, more itch. Understanding this helps break the cycle gently. A gentle pause. If your throat feels sore, your voice feels weak, or your throat keeps itching, please remember, these are common experiences. They are not failures of your body. They are signs of healing in progress. Your body is asking for rest, hydration, patience. In the next part of this video, we will talk about the sensation of something stuck in the throat, pain when swallowing, subtle symptoms that often cause worry, but usually have gentle explanations. The feeling of something stuck in the throat and pain when swallowing. Sometimes, the throat does not hurt sharply. Instead, it creates a strange sensation, a feeling that something is there, even when nothing actually is. You swallow, you clear your throat, you drink water, but the feeling stays. This sensation can be unsettling. In this part of the video, we will gently explore this experience, what it means, why it happens, and how to understand it without fear. The sensation of something stuck in the throat. When the throat feels full or blocked, many people describe this feeling differently. Some say, "It feels like a lump in my throat. Something is stuck, but I can't cough it out. My throat feels tight. I keep swallowing, but nothing changes." This sensation is often called a globus sensation. Despite how real it feels, there is usually no physical object blocking the throat. Why does this sensation happen? The throat is made of muscles, nerves, and soft tissue. All of these can react to irritation and stress. Common causes include inflammation from viral infections, muscle tension in the throat, post-nasal drip, acid reflux, dryness, anxiety. During illnesses like flu or COVID, the throat lining becomes sensitive. Even after major symptoms improve, the throat may remain tight or irritated. This can create the sensation of fullness. The lump in the throat during infection. During viral infections, the immune system causes swelling, increased blood flow, muscle tension. All of these can make the throat feel different. You may notice the sensation is worse when swallowing saliva. It improves slightly when eating. It becomes more noticeable at night. This does not usually mean obstruction. It is a sensory response, not a blockage. The role of muscle tension. The throat muscles react strongly to stress. When you are anxious or worried, you may unconsciously tighten these muscles. This can create tightness pressure, a stuck feeling. Many people notice the sensation increases when thinking about symptoms, feeling stressed, being alone at night. This does not mean the symptom is imaginary. It means the nervous system is involved. The connection to coughing and throat clearing. When the throat feels blocked, people often try to clear it. They cough. They swallow repeatedly. Unfortunately, this can irritate the throat further. This creates a cycle. Sensation, throat clearing, irritation, stronger sensation. Understanding this cycle is important. Gentleness helps more than force. Why drinking water helps, but doesn't fix it. Many people reach for water. Water can moisturize the throat, temporarily reduce irritation, but the sensation may return soon after. This is because the cause is often sensitivity, not dryness alone. Hydration helps, but time and rest are equally important. Pain when swallowing. When a simple action becomes uncomfortable, swallowing is something we do hundreds of times a day without thinking. When it starts to hurt, it immediately draws attention. Pain when swallowing may feel like sharp pain, burning tightness, a pulling sensation. It may affect solid foods, liquids, even saliva. Why does swallowing become painful? Pain. When swallowing usually happens because the throat lining is inflamed. Small movements stretch irritated tissue. Common causes include viral throat infections, persistent coughing, sore throat, swollen tonsils, dry throat. When the tissue is inflamed, even normal movements can hurt. This does not mean damage. It means inflammation, pain. When swallowing in COVID and flu. In viral illnesses, swallowing pain may appear early or develop after coughing for several days. People with COVID often describe tight pain rather than sharp pain, discomfort deep in the throat, pain without visible redness. In flu, pain may feel stronger, more sudden, accompanied by fever. Both experiences are common. How swallowing pain changes over time. Early stage, mild discomfort, sensation when swallowing saliva. Middle stage, clear pain with food, increased awareness. Recovery stage, pain decreases slowly. Sensitivity remains. Healing is gradual. Pain does not disappear all at once. Why swallowing pain feels worse at night. At night, throat becomes drier, less saliva production, more awareness of sensation. This can make swallowing pain feel stronger. Again, this does not mean the condition worsened. It means the environment changed. A calm perspective on these symptoms, a lump-like feeling in the throat and pain when swallowing, can be deeply uncomfortable. But they are often functional symptoms, not dangerous ones. They reflect sensitivity, inflammation, muscle tension, healing in progress. The throat is asking for patience. A gentle message. If you are listening to this and constantly checking your throat, please pause. Take a slow breath. Your body is not failing you. It is recovering in layers, some visible, some subtle. In the final part of this video, we will talk about red, swollen throat, overall reflection, and gentle care, and we will close this long journey with calm reassurance. Red and swollen throat, closing reflection and gentle care. Sometimes, when you look into the mirror and open your mouth, you see it clearly. The throat looks different, redder, swollen, irritated. This visual change can be alarming. It turns a feeling into something visible. In this final part of the video, we will gently talk about what a red, swollen throat means, why it happens, and how to close this long conversation with understanding rather than fear. Red, swollen throat. When inflammation becomes visible, a healthy throat is usually pale pink. When the throat becomes red or swollen, it is a sign of inflammation. Inflammation is not an enemy. It is the body's way of saying, I am responding. I am protecting. I am repairing. Why does the throat turn red and swell? During infections such as flu or COVID, the immune system increases blood flow to the affected area. This causes redness, warmth, swelling, sensitivity. The throat tissue becomes fuller, sometimes tight, sometimes sore. This is a normal immune response. Red throat in viral illness. In viral infections, redness may be mild or intense. Swelling may fluctuate during the day. Pain may come and go, you may notice. Throat looks worse than it feels, or feels worse than it looks. Both are possible. A red throat does not always mean severe illness. It often means the immune system is actively working. Why swelling can make symptoms feel stronger. When tissue swells, space becomes tighter. This can cause sensation of pressure, discomfort when swallowing, voice changes, increased coughing. Even small swelling can create noticeable sensations. This is why throat symptoms often feel intense, even when the illness itself is mild. How long does redness and swelling last? Healing is not linear. For many people, redness appears early, peaks within a few days, gradually fades, but sensitivity may remain longer. The throat is constantly in motion, breathing, speaking, swallowing. This slows healing. Time and gentleness are essential. Gentle care for the throat. While the body heals itself, simple supportive care can help comfort the throat. These actions do not cure illness, but they support recovery, staying well hydrated. Breathing moist air, resting the voice, avoiding throat irritation. Silence, warmth, and patience are powerful allies. The role of comfort and routine. During illness, routine brings calm. Warm drinks, soft foods, quiet evenings. These small comforts signal safety to the nervous system. When the nervous system relaxes, muscle tension decreases. This can reduce throat tightness, the urge to cough. The sensation of blockage. Healing is not only physical, it is neurological and emotional as well. The emotional side of throat symptoms. The throat is a vulnerable place. It is where we speak, where we express, where we breathe. When throat symptoms persist, people often feel frustrated, worried, tired of not being normal. These feelings are natural, but healing does not follow a schedule. Comparing yourself to others only adds pressure. Letting go of constant checking. It is tempting to look at your throat often, monitor every sensation, analyze every cough, but constant checking keeps the nervous system alert. Gentle trust allows healing to unfold. You do not need to fight your body. You need to listen. When to seek professional care. While most throat symptoms improve with time, some signs deserve medical attention, such as difficulty breathing, severe or worsening pain, inability to swallow fluids, high fever that does not improve. Seeking help is not weakness, it is wisdom. A final reflection. Throughout this video, we have talked about dry cough, productive cough, prolonged coughing fits, nighttime cough, sore throat, hoarseness, itchy throat, the feeling of something stuck, pain when swallowing, red, swollen throat. Each symptom is different, but they share one truth. They are messages, not punishments. Your body is communicating in the language it knows best. A soft closing message. If you are listening to this while unwell or while recovering, please hear this. You are not broken. You are not weak. You are healing. Healing does not always feel gentle, but it is happening quietly, patiently. Allow your body the time it needs. Rest is not giving up. Rest is cooperation. Closing breath. Take a slow breath in and gently breathe out. Let your throat soften. Let your shoulders drop. There is nothing you need to fix right now, only something to allow.